Bipolar disorder is characterized by episodes of mania and depression. Mania is an increased, exaggerated, or irritable mood with increased activity or energy. Mixed episodes are when one will have mania and depression at the same time. These patients can have increased activity or agitation and feelings of worthlessness or thoughts of suicide. Listed are the four most common types of bipolar spectrum disorder. Type 1 is one episode of mania and at least one clear episode of major depression. Type 2 has longer periods of depression that alternate with brief periods of hypomania. Hypomania is less severe than a manic episode, usually lasting 2 to 4 days. Cyclothymic is periods of hypomania and depression lasting more than 2 years. Unspecified bipolar disorder means symptoms or features that do not meet criteria for others mentioned above. It is important to note that these disorders vary in severity from person to person. Bipolar disorder is a multi-system illness including genetics, neurotransmitter malfunction, neuroendocrine alteration involving the HPA axis, anatomy changes, and physiological influences like stress and child abuse. Bipolar spectrum disorders have been found to have a strong genetic link. Highlight that. As nurses, we need to keep in mind that these patients need to have food for on the go when experiencing a manic episode. Food should be high in protein and calorie dense. Monitoring for fluid status is important as well. We as nurses need to set limits on the behaviors of manic patients to improve safety of the patients and staff. We need to minimize environmental stimuli during mania and offer safe activities to keep these patients busy while maintaining safety. Teaching is important for the patient and their family. Teach about what precedes a manic episode. Reduction to sleep is often indicative of an impending manic episode. Teaching also improves medication compliance, which is of great importance to manage bipolar spectrum disorders. There are many options for treatment of bipolar disorder: mood stabilizers, antipsychotics, anxiolytics, and anticonvulsants. ECT can also be used for those with bipolar disorder that have resistance to treatment. Lithium is one of the first-line treatments used. During initial therapy, it is important to monitor serum levels to achieve therapy. Cognitive behavioral therapy helps the patient to accept illness and seek medical treatment. CBT can also decrease affective symptoms, increase social functioning, and reduce rate of relapse. Interpersonal therapy focuses on relationships and routines that could increase mania or depression. Family therapy helps families to stay together and improve family functioning. Here are some possible nursing diagnoses for a patient with bipolar disorder. Risk for injury is important to keep in mind for the patient that has excessive and constant motor activity. See page 231 in our textbook for rationale of some of these diagnoses. Here's a question regarding lithium levels. Take a moment to pause and answer. If you picked B, you are correct. Thanks for listening. I look forward to your feedback.